How addiction hijack the brain? This question, we replied this question in this lecture and speak about the addiction cycle. The brain normal reward system, as we mentioned before in the previous lecture, the brain is wired to seek out and repeat pleasurable experiences necessary for survival. Any activity like eating, social bonding, reproduction, these activities has a pleasurable experience. The mesolimbic dopamine system plays a key role in reinforcing these behaviors. When we experience pleasure, dopamine is released from the ventral tegmental area (VTA) to nucleus accumbens, reinforcing the behavior. How drug and addictive behavior hijack this system? Addictive substance like nicotine, alcohol, opioid uses a massive surge of dopamine, far greater than natural rewards. This excessive dopamine release overestimates the reward system, leading to reinforced drug use. Over time, the brain adopts by producing less dopamine naturally, leading to reduced pleasure from everyday activity, decreasing the number of dopamine receptors, making it harder to feel pleasure, and we call this process tolerance. Changes in brain structure due to addiction: prefrontal cortex impairment, responsible for decision making and impulse control, become weaker in addiction, make it harder to resist cravings. Amygdala activation involved in stress and emotional response, trigger intense craving and withdrawal symptoms when the drug is not available. Again, amygdala activation involved in stress and emotional responses, trigger intense cravings and withdrawal symptoms when the drug is not available. What about the cycle addictions? The cycle of addictions or addiction cycle. Firstly, initiation use, dopamine surge creates pleasure. Repeated use, the brain reduces dopamine receptor and tolerance occur. Compulsive use, the user need more of the substance to feel pleasure. Dependence and withdrawal, the user feel bad without the substance. Craving and replace, the prefrontal cortex weakened, making it harder to resist temptation. Some quizzes to test your understanding. Which brain region is responsible for decision making and impulse control? Nucleus accumbens, amygdala, prefrontal cortex, hippocampus. The answer is prefrontal cortex. How does the brain adapt to repeat drug use? It increased dopamine production. It reduced dopamine receptor, making natural reward less pleasurable. It stops all of the dopamine release. It increases the size of the hippocampus. The answer is it reduced dopamine receptor, making natural reward less pleasurable. Why do people experience withdrawal symptoms when they stop using an addictive substance? The brain is still producing too much dopamine. The brain has become dependent on the drug to maintain normal dopamine level. The drug has permanently damaged the brain. The hippocampus control withdrawal symptoms. The answer is the brain has become dependent on the drug to maintain normal dopamine levels. Which brain region is responsible for emotional response and plays a role in cravings? Hippocampus, prefrontal cortex, amygdala, and cerebellum. The answer is amygdala. Let us discover the scenario Jack addiction of opioid. Jack, his 32-year-old construction worker, was prescribed opioid for back injury. At first, At first, the medication relieved his pain and made him feel good. Over time, he found himself needing higher doses to get the same effect. When his prescription ran out, he started feeling anxious, irritable, and physically sick. He began buying opioids illegally to avoid withdrawal symptoms, even though he knows the risk. He can't seem to stop. Uh, Let us discuss this case. What is happening in Jack's brain that make it difficult for him to stop using opioids? The answer is his dopamine receptor has been reduced, making natural reward less pleasurable. His prefrontal cortex is weakened, making it hard to resist cravings. Why cravings? Why does Jack experience withdrawal symptoms when he stops using opioid? The answer is his brain has become dependent on opioid to maintain normal dopamine function. When the drug is absent, he feels sick and anxious. What treatment options could help Jack overcome his addictions? Possible answer: medication-assisted treatment, methadone, morphine, cognitive behavior therapy to change thought patterns, support group, and counseling for